At Atchison Hospital and Clinics, we provide service and care in a number of ways to our patients, to family members and visitors, and even our coworkers. Whether it's direct patient care, administrative services, or hospitality and maintenance services, our goal is to provide the best experience possible to everyone who comes through the doors of our facility. CARE's behavior standards are guidelines developed to assist us in building the kind of culture we want to have in our organization. A culture where patients' clinical and emotional needs will be met and where our own staff feel valued, cared for, and recognized. CARE standards have been an integral part of our organization for several years. They are integrated into our daily work practices, as well as our hiring and interview process, new employee orientation, and employee evaluations. We are excited to share with you and recognize the extraordinary stories of our 2018 CARES recipients. C. C is for courage. Courage in the face of change. Seeking to understand industry and organizational change and considering ways to improve one's own skills, knowledge, and behavior in order to adapt effectively. Courage.
What courage means to me: stepping out of your boundaries, taking charge, being innovative. My name is Todd Forbes. I work in the Information Technology Department. It's a very challenging role. I'm able to make a huge difference in the organization. I can go meet with each one of the departments and say, hey, how can we make your lives a lot easier? And it's really rewarding to be able to go to them and just make a difference in their lives. Because if their job is easier, they can focus more on patient care or dealing with their day-to-day things they need to do. So that's why I really enjoy just making a difference.
The reason that I nominated him is we are implementing a new electronic health record, and our Meditech specialist made the comment that out of all of the hospitals that she has helped set up, that our hospital is the most advanced that she had ever seen. And it's because of Todd and the efforts that he's put forward for that. Todd is the epitome of a hard worker. He wants to do things right, test things to make sure that they work accurately. He's a problem solver, loves to make sure that everything is done on time and that everything's working accurately.
I find a lot of joy in helping out the staff. Pretty much the entire job gives me a lot of pride. Seeing what systems I put into place helps them improve patient care.
Within our CARES program, there was one individual who really stuck out to me. That is Matt Hines, and I nominated him for the Courage Award because of his efforts and dedication to kind of manhandling our phone system, and he's taken a tremendous amount of pride with working out the kinks for us, and we are back in a manageable space.
By extension, I get to help the patients out in my own way, providing a good network for them to actually connect to websites whenever they're in here as an inpatient, or if they are trying to get in contact with us.
Matt has gone through and worked out a lot of the bugs, has really taken a tremendous amount of ownership in making sure that each user is 100% happy with the access that they have and that the phone lines are being directed to the appropriate location. It's just been fantastic since all of his hard work has taken place.
The effect that we have on patients, that they feel like we're actually taking better care of them in the long run. If a patient calls in and actually feels like that they're actually communicating and getting their needs met by the hospital, that makes me feel better.
His work ethic is paralleled with so many other great people here, but he just has a tremendous duty to serve and get things right.
I'm Paige Schmidt, and I work in centralized scheduling. Every patient that I interact with, I try to think about them and their particular situation and the things that they might be going through. So I just like to look at every individual situation and do anything that I can to make their experience better.
The reason that I nominated her was because she had the courage to not take no for an answer, to step up and be an advocate for the patient.
So I just like to look at every individual situation and do anything that I can to make their experience better. There was a provider that ordered a test for a patient and it did not get authorized.
Paige took it upon herself to call the insurance company and advocate for the patient and ask why it wasn't covered, if it was something that was so medically necessary. The insurance company took that into consideration and we were able to get the test covered for her.
Whenever I have a comment from a patient that I've helped them in some way or made something easier for them, that gives me pride and confidence in my work, just knowing that I am doing something to help somebody.
She loves people and she loves to work with patients. She's done different roles here in the hospital, but she seems to really shine and excel. Her ability to help people follow problems all the way through to the finish and really be there and do what it takes to get the job done.
A. A is for accountability. Consistently known for self-accountability. Following Atchison Hospital and regulatory standards and policies. Taking pride and ownership in making a difference at work. Accountability.
I started out in housekeeping in '81. I'm always out for a little, something extra, to keep me busy. I love to work. I can't sit still. Ever since I was 9 years old, I've always made sure I've, kept busy. And I love my job. I love helping people. CARES is a really great program. It shows even the people out in the community that we do appreciate, everything that all the workers do here. And we're accountable for all of our actions that we provide and all of our services that we provide here.
I nominated her because I went out there and she was going through trash to find some personal belongings of a patient and their family member.
A gentleman had lost his wallet on med-surg, I was told, so I went out in the dumpster to try to find it, but there was no success in that.
I went outside to take my trash out and I found her out there trying to dig through all the trash and see if she could get through enough of it to find the patient's belongings.
I take pride in all the things I do out there, and I make sure that it's done right.
Mary Ann's always running around. She's always helping everybody. She'll put something aside. She'll go help you do whatever you need, and then she goes right back to doing what she needs to do. She's nonstop all the time.
It is definitely a small community hospital, but it's a very tight, close family that you get to work with. I think that's something that's really important when it comes to healthcare.
I nominated Kibby Benson for accountability. One day we were extremely busy in the emergency department, and she came in and she said,
Hey, what can I do to help you guys out? What can I do to make this easier? So I cleaned rooms, I labeled blood tubes.
She says, I'm gonna run it over. She comes back, she says, what else can I do?
I helped patients get from room to room, helped them to the restroom, and just kind of made their situation a little bit less stressful than what they were dealing with.
That is accountability. And she does it wasn't just a one-time thing. It's anytime she works, that is Kibby. That's what she does.
Something that I find pride in my work is, like I said, patient care. And I believe that starts with, first of all, your teamwork and having that strong team to be able to have the best patient outcome for your patients and have that patient care there.
She does whatever it takes to make the team effort a total team thing and make it the best that it can be.
It's a real family environment. I like it's professional, but I feel like it's a big family, and we all work together. We all have the same goal, is to provide compassionate and professional care to the patients. Sometimes you have to go outside of your scope of work to get the job done and get it done correctly, and I take pride in not only doing my job, but helping the others around me and even the patients and the patients' families. It's important.
So I nominated Chastity Durant. She is the ward clerk in the emergency department. She was willing to come in on her day off and sit with a patient that was outside of her comfort zone. She was willing to do that because she is always willing to help, and she's a real team player.
The med-surg manager called me in the afternoon, asked if I was available to come and sit for the night shift with the patient. As you know, I'm an admitting clerk, so this is something out of my scope of work and my training, but I figured, anything to help out and get the job done and help the patient and his family. So it was a positive experience, I guess, maybe for everybody. So
Chastity is always willing to go the extra mile, and she does her job with a great attitude. She's always willing to help people. She is always available to help any patient that comes in, any family member. I always enjoy working with her because she brings positive vibes with her when she comes to work, and I love that.
R is for respect, valuing diversity and respect of others' viewpoints and traditions, even during conflict, being an active listener and seeking to understand the spoken and unspoken needs of others. Respect.
I love the people. I don't work much with the patients, but the few patients I do interact with are great, and the staff is great. It's just a nice environment to come into every day. Anytime that you have a chance to help someone else that either is in the wrong situation or just not having, good luck at the time, I feel like you can jump in and help.
I nominated Karen Falk because we had a mother and baby in the hospital that did not have funds to purchase a car seat. So I called Karen and asked her if she would be able to help me find a car seat for this baby.
I can't imagine being in that situation, so right away I said, let me help, let me see what I can do, and I'll get back with you. After work, I went to a couple local thrift stores to see if they had some car seats. They had several nice ones that just needed a little TLC. So I took it home, tore it all apart, cleaned it up, put it all back together, brought it in the next day, took it down to OB, and they said they would present it to the mom.
Not many people would do that. She's always been willing to help, always does a great job, and this was really a nice gift for the patient and her baby.
If I could, I wish I could do something like that daily for people in need, or just anyone that needs a little help out.
I think Karen is a special asset for the hospital, just willing to help in any way, and I think that makes her a great employee for the hospital.
Every patient should be treated with the utmost respect and caring and understanding. They're all here for a reason. It may not be a reason that I know about, but they're still patients no matter what.
Connie was nominated for the letter R for respect, and myself and another coworker of mine, we nominated her because we had a patient on the floor that came in to have a baby, and it happened to be the husband's birthday.
And he was real nervous before the birth even, and after the birth he called me just to tell me they'd had their baby. And then he proceeded to tell me it was his birthday.
She made him a surprise breakfast one day and surprised him with that, and he was so happy because all the attention was kind of focused on mom and baby, and then he kind of got his own little surprise also that day.
I was born a few hours after my dad's birthday, so I automatically was just touched by it. We just developed a bond for the days that they were here, and at the end he brought the baby by to see me before they left the hospital.
She always has a smile on her face, always upbeat. She's smiling, giggling all the time. So it's really nice to have that in this sort of environment sometimes.
I answer the phone and take patients' orders for their meals, but I also am like their confidant. They They tell me when they went to the bathroom. They tell me when they're happy, when they're sad, when they're worried about something. A lot of them have no family. Some of the older ones do. And it's just good to see and hear them on the phone because I can tell when they're not feeling well and when they're feeling good.
Cares is how we treat each other, how we respect each other, what we do, why we do what we do. And so everybody here in the hospital tries to take our patients first, make sure we treat everybody with the respect that they deserve and to the best of our abilities.
Anyone knows Joyce. She is a person that respects the innate dignity of every person that she works with. There was this one particular day that she just went above and beyond. We had a gentleman that had come in through the emergency room and he had been living in his car.
He said, well, that's my truck out there. He said it started on fire. And I said, well, what happened? And he said, well, I must have left my candle burning inside the pickup that I was using to keep me warm.
And so he lost everything. Joyce, out of the goodness and the charity that she has, she went over to Walmart and she bought him shoes, hat, gloves, socks, because he had lost everything. She just went above and beyond to help this gentleman.
I think I want people to function at their optimal level and not hurt.
Joyce is such an asset to the Atchison Hospital and our community. She is a great colleague. It's been a great honor to be able to work with Joyce throughout the years.
E is for excellence. Aspiring to a high level of excellence in all endeavors, investing in learning and generously sharing knowledge, striving to do the right thing, valuing honesty and integrity above all else. Excellence.
We have a great facility, wonderful staff, great colleagues, physicians, nurses, just everyone that really kind of tries to help everybody out. And that's what we're here for, is to give the best patient care. And I think that's why we work here, is to provide excellence.
We had a baby that was in the nursery for an extended stay for over a week. We would hold her and rock her, and sometimes she would just cry for hours at a time, and nothing could console her.
I was on call for that weekend. We weren't quite making headway the way we want, and couldn't be able to get baby home without getting some of these issues resolved. And obviously, being in the hospital longer and longer, we wanted to be able to get baby home with family as quick as we could, just so they could bond outside of the hospital.
Dr. Groth brought in a very expensive formula and several packages of bottles that he had purchased at his own expense. Wanted to try that formula to see if that would help comfort her. And
unfortunately, we were limited by the nutrition that we have here at the hospital, so we didn't have the formula that I thought might be even better for baby. So I just went out and did what I think everyone probably would do in the same situation. So I got, bottles and the formula already pre-made, brought them over for baby, and baby did great, and we were able to get baby home within the next 24 hours.
It doesn't matter with Dr. Groth, whether it's his patient or whether it's somebody that he's seeing as an on-call provider, he goes above and beyond for everybody he sees.
Wake up every day knowing that I'm blessed to be able to give the great care that we can here, and have the support to be able to be successful with that and use my knowledge to help everybody that we can, as well as uplift the whole organization.
Taking the joy in seeing somebody smile that, obviously isn't having the best day. They're at the hospital. It's not the place they want to be at, but just interacting with them, making sure that they have a good experience, not just with me, but in our department in general and at the whole hospital. If you can have somebody leave happier than what they came in with, that's definitely something that I take pride in.
Colt is one of those kind of employees that you ask him to do something and he will do whatever he can to help you, whether it's a part of what his job description is or not.
I had a patient that wasn't actually my patient. I was leaving for the day, and I walked out and I just saw a guy sitting there. His ride that he was supposed to have hadn't showed up, and he'd been sitting there for a couple hours. He relied on public transportation, so we came back inside, and Allison Stone actually helped me try to get a hold of the person that was supposed to be his ride. It went to their voicemail. So I said, well, I can take you home. Just hop in my car here real quick. And he said, okay, well, they were actually supposed to take me to Walmart. I had some prescriptions and some groceries I need to get. And I said, well, looks like we're going to Walmart. So we drove over to Walmart and he just gave me his list of stuff that he wanted for groceries. And I went and picked up all of his groceries for him. And then I met him back over at the pharmacy. He was in a little bit of a line and he got his medication. And then we went to go home and he actually didn't know exactly how to get there since he's relied on public transportation. So we kind of used some landmarks. I'm obviously not from Atchison, so I didn't know any street names or anything like that. Told me which street to turn down, and we eventually found it, so it worked out pretty good.
All of our patients love him, very friendly to them. And like I said, you ask him to do something, Colt is ready and willing and able to do whatever he can to help the team.
That's something, that I think everybody should take pride in, coming to work every day and not just being excellent for this community and the hospital, but for the patients that you're advocating for every single day.
I've always enjoyed the variety that family medicine brings as a physician. I've always felt like it was a special opportunity for me to, engage with people and try to help them move through the healthcare process and get the care they need. And again, I really like the variety each and every day. It's something new.
I nominated Dr. John Epley for the excellence category. He shows excellence in many areas, but especially his character. He is just a true person. He's very nice to work with. All of his patients love him.
I help take patients to the ER when they need to go, and I help them get to their lab and get to their x-ray orders, because I want to make sure they get their testing done so we can figure out, what the heck's going on with them.
I was walking down the hall and found him with a patient in a wheelchair waiting by the doors to the exit. He had just wheeled the patient from the exam room out to the door while her grandson was getting the car and picking them up. And he walked her all the way out to the door, got her in the car, and went back. And I just thought that was a good example of the excellence that he shows on a daily basis.
I take pride in advocating for my patients. I listen carefully to what their problems are, and then I like to encapsulate that with helping them get to whom they need to get to and get the tests ordered that need to be ordered so we can make an accurate diagnosis and get them feeling better.
Is definitely here for the patients. That's his number one focus all of the time. Sees as many patients as he can, but he also takes a lot of time with his patients, and they know that they are cared for and valued, and that he truly wants what's best for them in every given instance.
S. S is for servant. Seeing a role as a servant to others, passionately ensuring patients and their loved ones receive a high level of skillful care and compassion. Equally valuing service to coworkers within work areas and across the organization. Servant.
I grew up in this area, and so this is my home, and I love it. I get to serve the community that I grew up with, and hopefully they're doing better after we get to work with them and get them on their way.
Hannah Eckert is quite simply just a really good person. You feel that from the time you meet her. Patients feel that, you see that in her work ethic, and it just comes across in everything she does.
I try to take the principles of CARES and I try to apply it to every patient every time that I go see them for a visit. I try to apply being courteous and being thoughtful, and I just try to make it the best visit, best treatment I can every time.
I nominated Hannah Eckert for the Servant Award on behalf of a patient. I had went to see the patient, and she was talking about how wonderful home health had been, and she specifically was mentioning Hannah by name. She said Hannah had been her cheerleader, keeping her going, pushing her to go further, and she was just very grateful for all the care that Hannah gave her.
I try to apply my knowledge to help people get stronger, to keep people safe, and I get to help try to apply it to their individual lives so that they can be able to do more of what they want to do, get back to doing what they'd like to do. I just want them to be as functional as they can in their daily life.
When I think about Rhoda, I think about the big smile that greets the patients when they walk through the door. She's always looking for what she can do for the patient, whether it's while they're there in the emergency room or even when they leave the emergency room.
I like working at Atchison Hospital because it's where I was born and raised, hometown, and everybody, employees and patients and everybody are like family. And it's just a good feeling to be able to help give back to the community and take care of the community.
Rhoda was nominated in the S category. I think this category really exemplifies nurses in this case that are trying to give their best care to patients, make their care very patient-centered and patient-focused.
Well, I was nominated by a patient who was in the emergency room, and she was very ill, but she was also very scared. The fact that I was there, I was comforting to her. I was able to hold her hand and get her through the sickest part of her illness. Like all my patients, I was there for her. I was treating her as if she was my mother, my sister, my aunt. She felt good knowing that I was there to help her. I try to be that way with everybody, whether you're a stranger off the street I've never met or if you're somebody I've known for 100 years. I try to treat everybody the same, and that's just kind of how my motto is. You know, treat them like they're your family, comfort them, and do whatever I can to make their stay better.
You asked what makes this place special or an excellent place to work. It's my coworkers and the great physicians that we have. So I'm very lucky and very blessed that I've always worked with very good, capable, well-knowledgeable people. It makes everybody's life a little bit easier.
Gail was nominated by a patient and the spouse. Both of them sent letters saying how she had relieved their anxieties and fears when they were in the hospital, what a wonderful nurse she was.
He was very apprehensive about being admitted to the hospital. Had kind of a rough night, so when I went in that morning, I did my best to alleviate his fears and to reassure him that he was going to be okay.
The patient experience is really important, and Gail epitomizes being able to address the needs of the patient in a timely and effective manner.
Being a servant to the patients here means providing them the best patient care possible. It means sitting down on the bedside, holding their hand, going for a walk, sharing stories, just every aspect of care that that patient would possibly want at this point in time.
Gail has enthusiasm, she has pride, and she wants every patient to get exactly what they need. You don't see Gail lollygagging. She is almost running down the hall throughout the day. She's a hard worker.